Welcome back to Mountain Connections. Now we are heading into the month of November next week, and November is actually Lung Cancer Awareness Month. A startling statistic is that 1/4 of all cancer deaths are actually related to lung cancer, which is more than all of the other cancers combined. Joining us today to talk about how you can be an advocate and personalize your care as you head into diagnoses and testing for these things are Dr. Mark Socinski and patient Tiffany. Thank you so much for joining us this morning.
Thank you for having us.
Thank you. Good morning.
Good morning. So, doctor, tell us a bit more about how you can be an advocate for your health as you are going into lung cancer testing, and tell us about the biomarker testing as well.
Yeah, it's very important to understand two things. One is the stage of your cancer, because that dictates the treatment that you should get. And the second is understanding the diagnosis. Part of the diagnosis is the fact that cancer is a disease of your DNA, and you have to interrogate the DNA to see if there are any specific alterations in the cancer DNA. We refer to these as biomarkers. If you can detect any alterations that have specific targeted therapies associated with them. These targeted therapies tend to be more effective than chemotherapy or immunotherapy, but the only way that you can get access to these highly effective targeted therapies is to make sure that your doctor does comprehensive genetic testing of the tumor DNA at the time of diagnosis.
That's so interesting and really helpful information. Now, doctor, tell us, what tips can you share for recent lung cancer diagnoses?
You know, again, it gets back to understanding the stage, because that's going to dictate the general treatment strategy that your doctors will use. And again, I can't underscore the importance of making sure that all of the biomarkers are tested for in a comprehensive fashion. This is very passionate to me. I've done lung cancer now for 30 years. And we're partnering with AstraZeneca coming into Lung Cancer Awareness Month to make sure that lung cancer patients and their families know that it is absolutely the standard of care that all of these genetic alterations be tested for, because we have a number of effective therapies that patients can't have access to unless they do the testing and find these alterations. So that really underscores the importance of comprehensive testing.
Now, Tiffany, explain to us what led to your diagnosis.
Sure. I was actually not feeling well. I was very fatigued. I had a lot going on in my life. I had lost a lot of weight. I am a registered nurse, and I was getting ready for work the one morning, and I started to have a twitch in my eye and one in my arm. And I knew I was going to lose consciousness, so I called 911, and the paramedics found me, and I was unresponsive. They had actually thought I had had a stroke. However, I had, when they scanned my brain, they found a mass, and they continued to scan my body from there, and they found another mass in my lung, which led to my stage 4 lung cancer diagnosis that had spread to my brain. It would be days before I would really regain consciousness and understand what was going on. But I did have a biopsy completed, and as Dr. Socinski had talked about, I had this biomarker testing done, which was a great tool to talk with my doctors for what was going to be the best treatment plan. I am currently right now over 5 years out, and I also just celebrated in July not only my 5-year cancerversary, but 1 year no evidence of disease.
Well, congratulations on that. That's really exciting news, and we appreciate hearing your story. Now, doctor, as lung cancer remains the leading cause of cancer deaths, how do you remain hopeful for the future?
You know, I remain hopeful because when you look at most recent cancer statistics in terms of survival, we saw the greatest reduction in cancer deaths than had ever been seen in the United States. And one of the cancers that led that reduction was lung cancer. So historically, we've thought of lung cancer as a death sentence, but there have been so many developments, new immunotherapeutic approaches, all these targeted therapies that we have. Again, with regard to the targeted therapies, these are highly effective therapies that you cannot use unless you do comprehensive genomic testing. So this underscores the importance that this is part of the standard of care, of the standard diagnosis to identify these markers so that patients can gain access to these highly effective therapies. And so that's why I remain hopeful and optimistic that we're going to continue to build on these gains as time goes on.
Wonderful. Now, Doctor, tell us, where can we go for more information on biomarker testing?
A place to start is diagnosisstories.com. It'll give you a lot of information about lung cancer in general, as well as information about a specific biomarker testing and that sort of thing. So diagnosisstories.com.
Wonderful. Well, Dr. Mark, thank you so much for joining in. Tiffany, we are celebrating your survival with you, and thank you for sharing your story. It's very important to be aware and be an advocate for your own personal health. Now, stay tuned. We have a lot more here on Mountain Connections, so don't go anywhere. We'll be right back.